Next, we turn to the healthcare battle, which shifted west today. President Obama flew to Belgrade, Montana. It's a conservative town in a conservative state, to hold a town hall meeting and press his case for healthcare reform. While it was generally a friendly audience, the president specifically asked to hear from his critics.
We keep getting the bull. That's all we get is bull. You can't tell us how you're going to pay for this, but you have no money. The only way you're going to get that money is to raise our taxes.
You are absolutely right that I can't cover another 46 million people for free. Even after we eliminate some of the waste, and we've gotten those savings from within the healthcare system, that's only 2/3. And then the other third, we would have to find additional revenue, but it wouldn't come on the backs of the middle class.
While dozens of town hall meetings are being held across the country, a lot of the action is happening in Washington. Groups with a keen interest in how healthcare plays out and with deep pockets are all hiring Capitol Hill lobbyists and doing so at a breathtaking rate. Here's David Wright.
Today in Montana, President Obama expressed concern that special interests are trying to Shanghai the healthcare debate.
Every time we are in sight of health insurance reform, the special interests fight back with everything they've got.
Currently, 3,300 lobbyists are registered to pressure lawmakers on health care reform, according to a Bloomberg News investigation of Senate records. The health reform lobbyists outnumber the congressmen 6-1.
Insurance companies battling providers, drug companies battling insurance companies, hospitals are into war against nursing homes. All kinds of different institutions are looking to protect their bottom interest.
In other words, they're hoping to shape the legislation in ways that will either protect or profit them. Drug companies alone have spent more than $134 million on lobbying during the first 6 months of this year.
And that's just what they're spending on shoe leather. Well-heeled lawyers walking these halls at the Capitol, buttonholing members of Congress. Of course, the other way special interests try to buy influence is through campaign contributions.
Senator Max Baucus, who chairs the committee drafting the Senate health bill, is number 4 in total contributions from health care and insurance interests. Nearly $4 million over 20 years, raised at events like Camp Baucus, an annual fly fishing and golfing weekend the senator held 2 weeks ago in Big Sky, Montana. Oh, and by the way, 5 of his former staff members are now lobbyists for health care and insurance interests. The Republicans are raising their fair share, too. The health industry is Senator Chuck Grassley's biggest rainmaker, $600,000 so far this campaign cycle. Senator Orrin Hatch, a senior Republican on the Health Committee, has pulled in nearly $1 million.
Money is going to speak louder than the merits of the legislation.
Out on the campaign trail last year, Obama vowed he wouldn't let that happen.
I'm going to have all the negotiations around a big table. We'll have doctors and nurses and hospital administrators, insurance companies, drug companies. They'll get a seat at the table. They just won't be able to buy every chair.
But the table is getting pretty crowded with special interests. David Wright, ABC News, the Capitol.